Hi everyone and welcome to my channel with BB. This video of mine is about varicose veins. Well, varicose veins are twisted and large veins. Any superficial vein may become varicose, but the veins most commonly affected are those in your legs. That is because standing and walking upright increases the pressure in the veins of your lower body. For many people, varicose veins and spider veins, that is a common mild variation of varicose veins, are simply a cosmetic concern. For other people, varicose veins can cause aching pain and discomfort. Sometimes varicose veins lead to more serious problems. Treatment may involve self-care measures or procedure by your doctor to close or remove veins. Earlier on this channel, I have already uploaded a short video about varicose veins. I hope you have already seen that video, and today I am going to present this illness in detail. Well, first of all, let me tell you the symptoms. Varicose veins may not cause any pain. Signs you may have varicose veins include veins that are dark purple or blue in color, veins that appear twisted and bulging. They are often like cords on your legs. When painful signs and symptoms occur, they may include an achy or heavy feeling in your legs, burning, throbbing, muscle cramping, and swelling in your lower legs, worsened pain after sitting or standing for a long time, itching around one or more of your veins, skin discoloration around a varicose vein. Spider veins are similar to varicose veins, but they are smaller. Spider veins are found closer to the skin surface and are often red or blue. Uh, Spider veins occur on the leg but can also be found on the face. They vary in size and often look like a spider's web. Uh, Self-care such as exercise, elevating your legs, or wearing compression stockings can help you ease the pain of varicose veins and may prevent them from getting worse. But if you are concerned about how your veins look and feel and self-care measures have not stopped your condition from getting worse, you should see your doctor. Now let me tell you the causes. Weak or damaged valves can lead to varicose veins. Arteries carry blood from your heart to the rest of your tissues, and veins return blood from the rest of your body to your heart, so the blood can be recirculated. To return blood to your heart, the veins in your legs must work against gravity. Muscles contraction in your lower legs act as pumps, and elastic vein valves help blood return to your heart. Tiny valves in your veins open as blood flows towards your heart, then close to stop blood from flowing backwards. If these valves are weak or damaged, blood can flow backward and pool in the vein, causing the veins to stretch or twist. Now I'll tell you the risk factors. The risk factors that increase your chance of developing varicose veins are age. The risk of varicose vein increases with age. Aging causes wear and tear on the valves in your veins that help regulate blood flow. Eventually, that wear causes the valve to allow some blood to flow back into your veins where it collects instead of flowing up to your heart. Sex. Women are more likely to develop the condition. Hormonal changes before your period or during pregnancy or menopause might be affected because female hormones tend to relax vein walls. Hormone treatments such as birth control pills might increase your risk of varicose veins. Pregnancy. During pregnancy, the volume of blood in your body increases. This change supports the growing fetus, but it can also produce an unfortunate side effect, that is, enlarged veins in your legs. Hormonal changes during pregnancy may also play a role. Family history. If other family members had varicose veins, there is a greater chance you will have too. Obesity. Being overweight puts added pressure on your veins. Standing or sitting for long periods of time, your blood doesn't flow as well if you are in the same position for long periods. Now I'll tell you some complications. Complications of varicose veins, although rare, can include ulcers. Painful ulcers may form on the skin near varicose veins, particularly near the ankles. A discolored spot on the skin usually begins before an ulcer forms. You should see your doctor immediately if you suspect you have developed an ulcer. The second complication is blood clots. Occasionally, veins deep within the leg become large. In such cases, the affected leg may become painful and swell. Any persistent leg pain or swelling warrants medical attention because it may indicate a blood clot. It's a condition known medically as thrombophlebitis. Bleeding. Occasionally, veins very close to the skin may burst. This usually causes only minor bleeding, but any bleeding requires medical prevention. There is no way to completely prevent varicose veins, but improving your circulation and muscle tone may reduce your risk of developing varicose veins or getting additional ones. The same measures you can take to treat the discomfort from varicose vein at home can help prevent varicose veins, and these measures include exercising, watching your weight, eating a high-fiber, low-salt diet, avoiding high heels and tight hosiery, elevating your legs, changing your sitting or standing position regularly. Now I'll tell you about the diagnosis of varicose veins. Well, when patients come to us, we usually easily diagnose varicose veins by just doing a physical exam, including looking at your legs while you are standing to check for any swelling. Your doctor may also ask you to describe any pain and aching in your legs. You also may need an ultrasound test to see if the valves in your veins are functioning normally or if there is any evidence of a blood clot. In this non-invasive test, a technician runs a small handheld device about the size of a bar of a soap against your skin over the area of your body being examined. The transducer transmits images of the vein in your legs to a monitor so a technician and your doctor can see them. Now I'll tell you the treatment of varicose vein. Fortunately, treatment usually does not mean a hospital stay or a long, uncomfortable recovery. Thanks to less invasive procedures, varicose veins can generally be treated on an outpatient basis. You should ask your doctor if insurance will cover any of the cost of your treatment. If done for purely cosmetic reason, you will likely to pay for the treatment of varicose veins yourself. And there are some self-care measures. Well, self-care such as exercising, losing weight, not wearing tight clothes, elevating your legs, and avoiding long periods of standing or sitting can ease pain and prevent varicose veins from getting worse. Compression stockings. Wearing compression stockings all day is often the first approach to try before moving on to other treatments. They steadily squeeze your legs, helping veins and leg muscles move blood more efficiently. The amount of compression varies by type and brand. You can buy compression stockings at most pharmacies and medical supply stores. Prescription strength stockings also are available and are likely covered by insurance if your varicose veins are causing symptoms. And I'll tell you some additional treatments for more severe varicose veins. Well, if you do not respond to self-care or compression stockings, or if your condition is more severe, your doctor may suggest some other varicose vein treatments, which I shall tell you. The first is sclerotherapy. In this procedure, your doctor injects small and medium-sized varicose veins with a solution or foam that scars and closes those veins. In a few weeks, treated varicose veins should fade. Although the same vein may need to be injected more than once, sclerotherapy is effective if done correctly. Sclerotherapy does not require anesthesia and can be done in your doctor's office. And second option is foam sclerotherapy of large veins. Injection of a large vein with a foam solution is also a possible treatment to close a vein and seal it. And then we have laser treatment options. Well, doctors are using new technology in laser treatments to close off smaller varicose veins and spider veins. Laser treatment works by sending strong bursts of light into the vein, which makes the vein slowly fade and disappear. No incision or needles are needed. Then we have catheter-assisted procedure using radiofrequency or laser energy. In one of these treatments, your doctor inserts a thin tube, that is catheter, into a large vein and heats the tip of the catheter using either radiofrequency or laser energy. As the catheter is pulled out, the heat destroys the vein by causing it to collapse and seal shut. This procedure is the preferred treatment for longer varicose veins, for larger varicose veins. Okay. Now we have another option for treatment, that is high ligation and vein stripping. This procedure involves tying off a vein before it joins the deep vein and removing the vein through small incisions. This is an outpatient procedure for most people. Removing the vein won't keep blood from circulating in your leg because veins deeper in the leg take care of the larger volume of blood. Okay. Ambulatory phlebectomy is another procedure. In this procedure, your doctor removes smaller varicose veins through a series of tiny skin punctures. Only the parts of your leg that are being pricked are numbed in this outpatient procedure. Scarring is generally minimal. Then the last option is that we can do endoscopic vein surgery. You might need this operation only in advanced cases involving leg ulcer if other techniques fail. Your surgeon uses a thin video camera inserted in your leg to visualize and close varicose veins and then remove the vein through small incisions. This procedure is also performed on an outpatient basis. Varicose veins that develop during pregnancy generally improve without medical treatment within 3 to 12 months after delivery. Now I should tell you some lifestyle and home remedies. There are some some self-care measures you can take to decrease the discomfort that varicose vein can cause. These same measures can help prevent or slow the development of varicose veins as well. These measures include exercise. Get moving. Walking is a great way to encourage blood circulation in your legs. Your doctor can recommend an appropriate activity level for you. You should watch your weight and your diet. Shedding excess pounds takes unnecessary pressure off your veins. What you eat can help to follow a low salt diet to prevent swelling caused from water retention. Watch what you wear. Avoid high heels. Low-heeled shoes work calf muscles more, which is better for your veins. Do not wear tight clothes around your waist, legs, or groin because these garments can reduce blood flow. Elevate your legs. To improve the circulation in your legs, take several short breaks daily to elevate your legs above the level of your heart. For example, lie down with your legs resting on 3 or 4 pillows. Avoid long periods of sitting or standing. Make a point of changing your position frequently to encourage blood flow. Okay, well, this was my video about varicose vein. If you have any question about this problem, you can post in the comment section. And if you want me to upload a video about any other medical illness, for that video is already not there. Just write in your comments, and as soon as I get a time, I'll try to upload a video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.